The truth about testosterone. Debunking myths and misconceptions. Learn the truth about low testosterone, male hypogonadism, and debunk common myths and misconceptions. Discover what causes low testosterone, how it is diagnosed, and the various treatment options available. Explore the impact of low testosterone on sex, mood, thinking, and fertility. Understand testosterone therapy's risks and side effects, and determine who should not take it. Find out if testosterone therapy can promote youth and vitality. Also, discover the symptoms of low testosterone in females and the potential causes. Stay informed with this comprehensive guide on low testosterone. The truth about testosterone, debunking myths and misconceptions. Introduction. Testosterone is a hormone that plays a crucial role in both men's and women's bodies. However, there are several myths and misconceptions surrounding testosterone, particularly regarding low testosterone levels in men. This will debunk these myths and provide accurate information about testosterone. Low testosterone, male hypogonadism. Overview. Low testosterone, also known as male hypogonadism, is a condition where the body doesn't produce enough testosterone. Testosterone is responsible for various functions in the body, including muscle mass, bone density, and sexual function. What does testosterone do? Testosterone is a vital hormone that plays a role in several bodily functions. It is responsible for developing male sexual characteristics, such as facial hair, deep voice, and muscle mass. Testosterone also helps regulate sex drive, bone density, and red blood cell production. What is a low testosterone level? A low testosterone level is typically diagnosed when the levels fall below 300. However, it is essential to note that symptoms may vary from person to person, and a diagnosis should not be solely based on testosterone levels. Who does low testosterone affect? Low testosterone can affect men and women of all ages, but it is more commonly seen in older men. However, it can also occur in younger men due to various factors such as genetic disorders, chronic illnesses, obesity, and certain medications. How common is low testosterone? Low testosterone is more common than you might think. It is estimated that around 20% of men over 60 have low testosterone levels. However, it is essential to note that not all men with low testosterone experience symptoms. Symptoms and causes. What causes low testosterone? Low testosterone has various causes, including primary and secondary male hypogonadism. Primary male hypogonadism occurs when the testes are unable to produce sufficient testosterone. Secondary male hypogonadism is usually caused by problems with the pituitary gland or hypothalamus, which are responsible for regulating testosterone production. Diagnosis and tests. How is low testosterone diagnosed? Low testosterone is diagnosed through tests, including blood tests to measure testosterone levels. Doctors may also consider other factors such as symptoms, medical history, and physical examination. Management and treatment. How is low testosterone treated? Low testosterone can be treated through testosterone replacement therapy, TRT. TRT can be administered through injections, gels or patches, tablets or pellets. Treatment choice depends on various factors, including individual preferences and lifestyle. What are the side effects of testosterone replacement therapy? Like any medical treatment, testosterone replacement therapy may have side effects. These can include acne, fluid retention, breast enlargement, and changes in mood or behavior. However, the benefits of TRT often outweigh the potential side effects. Can low testosterone be prevented? While preventing low testosterone may not always be possible, confident lifestyle choices can help maintain healthy testosterone levels. Regular exercise, a balanced diet, adequate sleep, and stress management can all contribute to optimal testosterone levels. Living with. Why testosterone therapy, TT? Testosterone therapy can help alleviate the symptoms associated with low testosterone, such as decreased libido, fatigue, and muscle weakness. It can improve quality of life and restore hormonal balance. How do I take testosterone? Testosterone can be administered in various forms, including injections, gels or patches, tablets, or pellets. The method of administration will depend on individual preferences and doctors' recommendations. Are there side effects of TT? As mentioned earlier, testosterone replacement therapy may have side effects, but they are generally manageable and outweighed by the benefits for most individuals. Conclusion. Understanding the truth about testosterone is essential in dispelling myths and misconceptions surrounding this hormone. Low testosterone affects a significant number of men, but with proper diagnosis and management, it can be effectively treated. If you suspect you have low testosterone, consult a healthcare professional to determine the best course of action for your specific situation. Remember, accurate information is vital to debunking myths and making informed decisions about your health. You can book an appointment to see our doctor today.